So I would think that the best thing for them would be behavioral therapy, cognitive behavioral therapy, family therapy, sometimes medication. So behavioral therapy is really going to focus on getting them back to school. And there are certain things that we can do to have them do that, like make a fear hierarchy and start with little baby steps moving forward. Like we've had patients who we drove to the school and literally just drove past every day, driving past so they felt comfortable. That's when we had the luxury of summer break. After that, we had them walk in the halls, meet with personnel at the school that was still there, sit in the nurse's office. Then they might go to class, but only for 5 minutes. Then they might go for 15 and then increase it that way. So that's really the behavioral, and that's gradual exposure. The positive reinforcement is pretty obvious. Every time they take a step, they might get a point towards something, and it doesn't have to be anything that costs an exorbitant amount of money. It can be, special time where it's just that child and the parents, if that's rewarding, a special meal that they cook or go to together. And I've had kids even, have things where they went to Disneyland. So, it's anywhere in between that could be rewarding. And if you're creative enough or you have a circle that can help you, you can come up with something. The best thing is to have the child be involved in making these plans, because when kids make these choices on their own, they have the ownership, and that makes them more likely to go along with it rather than just shoving the plan on them. The parents are so important, and a lot of parents do a well-meaning accommodation for the anxiety. So they help the kids kind of stay in a safe spot that's not pushing them towards where they want their kids to go and where their kids need to go. So having that family therapy or parenting therapy is very beneficial. And then if it's really extreme, I would definitely suggest just as an evaluation with a psychiatrist to see if medication can help, even if it's just short-term medication to get them back in the groove.